Good morning, everybody. My name is Ryan Leisure, and I'm here today to talk to everyone about lung cancer prevention and why it's so important. So, I chose this topic because nowadays, especially in my area, we see a lot of pulmonary issues among patients, such as chronic obstructive pulmonary disease, congestive heart failure, and emphysema, which most times are related to poor lifestyle choices such as smoking or tobacco use. So we only get one set of lungs, which means we have to take care of them the best we can, which means staying away from cigarettes and other tobacco products that can cause lung damage, scarring and decreased function of the pulmonary system. And as we know, cigarettes have thousands of carcinogens in them that can cause cancer sooner or later. It scars the lungs, which decreases the amount of oxygen and carbon dioxide exchange. It puts an extreme amount of stress on the heart and other parts of the body, as well, leading to a decrease in function of multiple organs that are vital to sustain life. So, this presentation today is going to be focused on anyone who can be within reach of tobacco products. I know many patients that I take care of in the ICU. During their admission history, they've stated that they've smoked since they were 10, 11, 12 years of age, even though in the US, the legal age for tobacco products are 18 years. So, first off, for prevention, the best way to prevent lung cancer is to one, not smoke in the first place, or if you do already smoke, quit as soon as possible. So, as I've stated before, smoking is one of the number one leading causes of cancer in the world. Besides straying away from smoking or quitting as soon as possible, one of the other leading causes of lung cancer is exposure to secondhand smoke. You don't directly have to smoke in order to get lung cancer. Being around people who do smoke regularly, especially in the house or in cars, is enough for you to be at risk of developing lung cancer of your own. So there has been studies that show secondhand smoke sometimes can be potentially worse for one's lungs than smoking a cigarette yourself. So here is a short video clip that can visually explain the importance of quitting smoking and how your body adjusts over time. Well, I hope everybody enjoyed that video. I thought it was a great way to show a visual representation of how dangerous it is to smoke and what the benefits are as soon as you take your last puff at your last cigarette. So, like I said before, even though smoking is one of the leading causes of lung cancer, there are many other harmful things in the world that we are around every day that can increase one's risk of developing cancer. So, exposure to high levels of radon gas can cause respiratory issues and possible cancer. Radon is a gas that is emitted from the earth. It's a result of a breakdown of uranium in the ground around us. So, if this gas gets trapped in our homes, such as in the basements and lower levels of the homes, radon can build up and become a toxic level, which potentially puts you at risk for developing respiratory issues and essentially lung cancer. So, For radon, there's home tests that are available in many different department stores and home stores that you can test yourself for radon gas. It is very smart to check your home, or at least have it checked by a professional if you don't feel comfortable doing it yourself, to see if you have high levels of radon in the home. Another horrible substance that can cause lung cancer is exposure to asbestos, which as of today has been used in many older homes that have been built in the 1900s. Also, many jobs back then, such as mining and working in the mills, were very, very popular, and people were most likely exposed to asbestos at some point during their careers. So this asbestos can cause a specific type of lung cancer, predominantly called mesothelioma, which seems to affect the outer lining of the lungs. Besides those, excess exposure to radiation can also be a precursor to the development of cancer. So many people have been diagnosed with breast cancer or any types of other cancer, usually have been treated with some type of chemo or radiation. So yes, although this is meant to kill the cancer in the breast or other areas of the body from the cancer that you were previously diagnosed with, it also increases your risk of developing cancer in the lungs from the high amounts of radiation that's exposed to the body over the course of the time of you having cancer. So another thing that people don't think much about is family history. This is why it's so important for us as nurses and healthcare providers to accurately obtain a family history of a patient, so we can determine their risk factors and maybe possibly screen them accordingly. If you have a family history of lung cancer, it is very important to stay away from these things that can cause it, because your risk of developing this lung cancer is already way higher than people who don't have a family history of cancer. So as far as screenings go, there are many different ways that we can screen for lung cancer. One common way is a basic chest x-ray that a lot of times are done for other reasons and end up showing tumors or masses in the lungs that require more diagnostic testing. So the x-ray can show small abnormal masses or nodules that are present in your lungs at the time of the x-ray, and if you do show these on x-ray, most of the times your doctor will recommend further testing to rule out any types of malignancy. So a sputum sample can be a great way to go with a chest x-ray, since your sputum can be looked at under microscopic imaging to show any presence of cancer cells. To go even further into the diagnostic testing, a lung tissue biopsy may be considered. This is basically getting a sample of the tissue or the mass found. Doctors can test that specific tumor or nodule that they found for cancer and determine if it is malignant or not. So the tissue biopsy can be done in a few different ways, such as through a procedure called a bronchoscopy, where there's a camera and an instrument that's inserted through your mouth down into your lung. And then also we can do a needle biopsy, which is another way if, say, maybe a bronchoscopy has too many risks for that specific patient. So this method is done by inserting a needle through the chest wall into the lung tissue and taking a sample that way. The reason diagnostic testing is important is because the earlier we can catch cancer, the better chance that that patient will have a better outcome and possibly get rid of the cancer altogether. You want to ideally treat cancer before it gets worse beyond the point of treatment, or of course before it spreads to other vital organs in the body. So according to the U.S. Preventive Services Task Force, lung cancer screening is recommended for adults who are ages between 55 and 80 years old, but who have had a 30-pack-year smoking history and currently still smoke, or have quit smoking within the past 15 years. So at the end of this presentation, I'm going to be handing out a short 5 or 6 question quiz to the audience to determine if my presentation was successful in teaching you about the importance of and risks of lung cancer, and why it is important to be screened, as well as why it is important to understand the risks and the causes of lung cancer. My goal for this presentation was to give you a brief amount of information regarding the importance of lung cancer prevention and the different types of screenings that can be done to check for early stages of cancer. Again, it is most important to get screened for lung cancer as early as possible, especially if you have smoked or still do smoke. And like I said, the most important reason is because early treatment for cancer and early findings of cancer is the best way to have the best outcome possible. So again, if you smoke or have been exposed to excessive radiation, asbestos, or maybe even radon gas, it is even more important to be screened for you, because you are again at a higher risk of developing cancer than others who haven't been exposed to these types of harmful materials. So for my short question quiz, question number 1, what is the leading cause of lung cancer? Answers should be similar to smoking, secondhand smoke, asbestos exposure, any types of radiation exposure, especially if you've had chemo and radiation in the past for different types of cancer, or even a family history of lung cancer. Question 2, at what age is it recommended you be screened for lung cancer? The good answer would be between the ages of 55 and 80 years old for people who smoked for 30 years and still smoke or have quit smoking within the past 15 years. Question number 3, what are some diagnostic tests that can be done to test for lung cancer? A good answer for this would be a chest x-ray, maybe a CT scan, different types of lung biopsies, and maybe some sputum samples to look for cancer cells. Question 4, why is it important to get screened for lung cancer? A good answer for this one would be the sooner lung cancer is diagnosed, the better outcome you will have, and the less likely the disease is fatal or untreatable. Question 5, how could you find out if your home has dangerous levels of radon gas in it or around it? Answer for this, you can purchase a at-home self-test kit or have it tested by a professional. And question 6, what exactly is radon gas? Answer for this one would be it's a toxic gas that is produced by the Earth's soil, resulting from uranium being broken down to the soil. And it, of course, is very harmful. Well, I thank everybody for listening to my presentation, and I at least hope you've taken some of this information home with you today, and possibly some of you would maybe think about getting screened for lung cancer, since I'm sure at least some of you have smoked in the past or, again, still do smoke. Thank you.